I do. I have two questions, actually. I have one for Mr. Leach and also, if we can, one for Mr. Archer. Mr. Leach, how are we doing on the testing? How are we doing on contact tracing? Are we getting caught up? I had heard that there was some backlog, if you will. And then for Mr. Archer, can you touch on, I know we're subject to this region, like whatever our ICU capacity could be great, but we're at the liberty of not being able to say open back up until the region's capacity falls above or below the capacity desire. So is there any foresight on that? I heard 4 weeks a minute ago, but I'm not sure what that means, if you could clarify.
Doug, you want to go first?
Sure. Yeah, so the regions and kind of how we go in and out of lockdown, being grouped in the Central Valley region, I don't think is representative of Calaveras County. For instance, today we have 4 ICU patients out of 8 beds. So we're 50% capacity, which is much better than what we're seeing in the valley. So we don't really have, the jurisdiction or the ability to change that. All we can do is try to help out. But, our 4 out of 8 bed capacity is kind of a drop in the bucket when they're looking at the goal of 15% or more capacity in the Central Valley region. I don't know the exact number of ICU beds in the Central Valley region, but it's upwards of probably 400 or 500, if not more, easily more. Our 8 beds isn't going to put a dent in that. So unfortunately, I don't think we're going to be able to, unless they change the guidelines at the state level. I don't know that we're going to be able to have a huge impact on opening Calaveras up sooner than, say, Stockton.
And Councilmember Herndon, I appreciate the question about contact tracing. I was remiss in not getting into that. I had a lot of notes and flew through them, and I think I missed a whole section. So yes, we continue to do contact tracing. It has been a matter of prioritization, right? So right now we're in the depths of the surge, and you've heard the word surge, and it's like, okay, what does surge mean? Surge means that we're just seeing a spike in cases that we pretty much expected was coming. We knew that January, heading into the middle of January and possibly into late January, depending on what people do, is going to be the toughest time that we've seen. And the numbers have borne that out, right? So with contact tracing, it's definitely been a challenge for our team, especially with a change in leadership and me coming in and saying vaccines are a priority, testing is a priority, right? So if everything's a priority, then nothing's a priority, right? The old adage. And frankly, we are still doing contact tracing. But right now, with the level of the surge, the thing that I need you guys to hear, and I want the public to understand, is that you really need to proceed right now during the depths of the surge as if everybody that you come in contact with has COVID. Right? This isn't March or April where, we were still asking each other, do you know anybody who's had it? Pretty much everybody who's listening to this knows somebody who's had it or has it right now. And if you're in my position, you know lots of people that actively have COVID right now. And some of them that are very sick, and frankly, some people who've passed away. So, this is a real thing. This is a real surge. And I need people to take this seriously and proceed as if everybody you haven't come in contact with has it. Wear your mask. Wash your hands. Keep your distance. Avoid large gatherings. It's consistent messaging from what we've had. But right now, we're seeing the ramifications of this thing just going on so long that people have grown tired of doing some of those things. And I really think that if we can give it a push for a couple months here while the vaccines are taking effect, then spring into summer is going to start to feel really different. And that's my hope. So with contact tracing, yes, we continue to do it. At the same time, with the surge being as high as it is, assume that everybody that you come in contact with has COVID and act accordingly.
Thank you, Mr. Leach. Ms. Herndon, is that the sum of your two questions?
Yeah, that about sums it up. Thanks so much.
Anybody else from Angels Camp? Okay, with that, I'm going to bring up a couple of things that I would like to talk to Public Health about and the rest of the Board of Supervisors. You know, as you all know, we have a new board member on the board this year. You know, when even just one on the Board of Supervisors change, it changes the continuity of the entire board. We're a different board now. And I would like to, in the interest of my predecessor on the chair spot, I won't be asking for a poll. This one time, I'll be asking if anybody would be opposed to us putting together a message as the board in its entirety towards, you know, maintaining social distancing, wearing your masks, and proceeding in the interests of health to keep our community open into the future. As I know, Ms. Callaway, I will not ask for that many words to be put into it, but you know, a consistent message from the entire board, and I would like support from the entire board on this type of message going out to the community. Is there anybody opposed to that from the Board of Supervisors? I appreciate the silence. That's a good thing. With that, I think I may sit down, you know, with Ms. Callaway and, you know, put together this message. It's something we discussed in the past. Nothing against you, Ms. Follendorf, but I think, you know, as long as no one's opposed to it, I'll sit down with Ms. Callaway and put together a message that we can send out with Public Health in that direction. We'll go with that. Is there anything else from any of the Board of Supervisors or Angels Camp as we proceed? Mr. Broglio.
Mr. Stopper, I would support everything you just said right there. So, well done and kudos. That's a good message to send out. Thank you.
Thank you, Mr. Broglio. We appreciate it, Mr. Mayor. With that, I'll let Angels Camp. Oh, Ms. Follendorf, my apologies.
No, I have one question for Sam. I wanted to see if we could get some information on the impact to the local EMT and ambulance services. Are they, what are they seeing on the ground?
I have heard some stuff. I'm not sure what I can share and not share. And frankly, Supervisor Follendorf, I'm not sure how much I recall. The main thing is that the message is clear from our fire captains and our first responders that, you know, this threat is real. The surge is out there, and these guys, you know, they're having to respond to a lot of calls. They're having to deal with COVID a lot. And frankly, if people don't take this seriously, you're running the risk of ambulances not being available to get to you. I mean, we've got to work together. We've got to come together as a community, stop arguing about this, and do the basic things you need to do to support our business owners and support each other by wearing a mask, by distancing, by avoiding large gatherings. These are the things we have to do to get the volume of calls and the amount of things that our first responders are reporting to. Because yes, anecdotally, I've heard those stories. I don't have data for you on that, if that's what you were looking for, but I know that it's a pressing issue. I've heard those accounts. Melissa, you're on the call, so maybe you can speak to that, because I know that you were on a call where I was, Mr. Rohrbaugh was telling us about it, but I don't remember the specific deals offhand. Maybe you do.
I don't have that specific information as it pertains to countywide. We did have some information that we released to the public as it pertains to a surge that we saw just before Christmas for the City of Angels. I don't remember those numbers, but I believe that our calls were up considerably from the fire chief's perspective. He wanted to make the community and the public aware. But we can work together and get more information for you, Supervisor Hollendorf, as I'm sure City Council will also appreciate that information.
Yeah, thank you for that, Melissa. Sorry to put you on the spot. I know that it was not a nominal or incremental change. It's been a significant volume increase for them. I just don't have data on it.
Thank you.
One last thing I would like to bring up and just potentially reach my hand out to Angels Camp as we proceed with this possible message. Maybe later on you can discuss it between you all and see if you want to join us in a joint message so we stay consistent across the county. We'll be in touch. We got to go through the proper process for putting out this type of message. So this gives us a little time before we address it. But please consider joining us and coordinating with us.
That sounds great, Ben. Thank you.
All right. If there's no other questions, I'm going to go ahead and let Angels Camp close out.
Thank you, Board of Supervisors. Have a good afternoon.
Mayor Berlio, could I request that we get a motion to adjourn?
Yes. Could I get a motion to adjourn, please?
I'll make a motion to adjourn.
Oh, one other thing. My apologies. I never asked for public comment. So at this point, I would like to, before you adjourn out, my apologies. I would like to give the public the opportunity to comment. We've addressed a lot, so here we go.
Sorry, yes, Chair Stopper, we do have a public comment.
Please proceed.
Good morning. This is Terry McBride, New California State Senator and Committee Chair for Calaveras County. I'm looking at these numbers and I see a total of 922 cases. Isn't that since March? So in over 10 months now, we've only had 922 cases in a county of 45,000. I kind of think that's maybe even less than the flu season. And apparently we have a cure for the flu and it's called Covid-19. And what's really interesting is that when I speak to people that have gone through COVID, they basically have the symptoms of the flu. So I have to wonder, because we've got a lot of money involved in this whole thing. You start following the money and you've got to start questioning just what in the world is going on, except watching my local business friends, because remember, I'm 5th generation from this county. My local business friends that are trying to figure out how in the world they're going to stay open and survive. And yes, isn't it nice that the government that shut them down is offering them grants? They don't want grants. They want to run their business. They want their Board of Supervisors and their City Council to follow the Constitution. And so I'm going to remind you all that you took an oath of office. And when you did that, you agreed to protect our constitutional rights. And when you violate that, you're in violation of the Constitution. So I would suggest that you look at our Constitution and learn it well, especially the 1st, the 4th, the 8th, and the 14th Amendment. When I look at press releases of the flu, which were really bad apparently in 2018 and 2019, I didn't see a word about shutting businesses. I didn't see a word about wearing a mask and walking in abject fear that I see in people's eyes. And yet when I look at total cases of over 10 months, it's only 922 in a county of 45,000. So I ask that you use common sense while you do this and understand you took an oath of office. I did too for New California, and I stand by it. And I hope that each one of you will, and really consider the choices you make as you move forward. Congratulations, Ben. I expect you'll do a good job. And congratulations, Amber Follendorf. I'm quite sure you will too. Thank you.
Thank you, Ms. McBride. Is there any other public comment available?
Yes, Chair Stopper, we have one other comment.
Thank you.
Thank you very much. I want to thank Sam Leach and Doug Archer for what I thought was really an excellent presentation. We got a lot more information we've all been wondering, and it was really good information. My question is to deal with the fact that we are now talking about providing doses to people, vaccines to people over 75 and to school teachers and staff. And so I'm just wondering, do we know how many people we expect to have to provide to, and where do we stand with the number of doses that we have or expect to have? Thank you. And my name is Robert Polikoff.
Thank you, Mr. Polikoff. Do you want to take the opportunity to answer that, Mr. Leach?
To an extent, yes. And Mr. Polikoff, I appreciate those comments, and they're good questions. As far as the number of doses on hand, that is such a moving target because we're vaccinating people every day. What I can assure you is we are not sitting on thousands of doses. I've heard some rumors out there. There's a lot of misinformation floating around out there. Some of that's my fault, right? But we're trying to clear it up today. At any given time, we may have a few hundred doses that, are being strategically, systematically is probably a better word, stored for the proper use. But as of right now, we don't always know what we're getting and when we're getting it from the state until very shortly before they arrive here. So our capacity is only so much, which is why it's really difficult to just come out with kind of a timeline or even a rough timeline of, when is my healthy 17-year-old daughter going to have access to this? Questions like that are further down the line from, frankly, our most vulnerable populations that we're focused on right now, while we have a limited number of doses and a limited capacity to administer those doses. We expect that both of those things, our capacity to administer doses and our actual number of vaccines on hand, are going to increase very quickly. And at times maybe quicker than we're ready for, and at times slower than we wish it would be. So that's been just the tremendous challenge that our Deputy Public Health Director and her team have been faced with in trying to navigate this storm.
So if I'm still there, yes, I guess I am still there. The thrust of my question is really, given the number of people over 75 and the number of school teachers and staff, do you think you have adequate doses to hit that entire population, or will have enough doses to hit that entire population?
I believe we will have. We do have enough to get moving, and we do know that we have more coming in. The question is how much, how fast. And when I say that we're working on those, understand that that's not an overnight thing. We have a pretty healthy population of people over 75 in this county. So that's going to take some time, and it's a heavy lift for Mark Twain. Obviously, we've got a lot of school teachers and school employees who need to be vaccinated, so that's a heavy lift for just, I could be wrong, but I've heard we only have about 4 school nurses throughout the county. So that's a heavy lift for them. But it frees us up to continue working at the same time with our other Tier 1A, Tier 1B, moving into Tier 1B populations. So what I think is going to happen, what I hope happens, is that we're going to start getting flooded with vaccines from the state. They're going to start pushing down more and more, and at times it'll be quicker than we're ready for. I'm sure my public health team is cringing right now, but as fast as they want to make us run, we're going to run. But we've got to do it systematically and orderly and equitably. We can't stray from that. There's a system to this, and we've got to get our vulnerable populations done first so that we're not putting their lives at stake.
Thank you very much. That's greatly appreciated. Thank you.
Thank you, Mr. Leach. Thank you, Mr. Polikoff. Is there any other public comments?
Yes, Chair Stopper, we have an additional one.
Okay, thank you.
Where did he go?
Hi, my name is Norm Rector. My big concern is how are you going to notify the residents of this county as to when it's appropriate for them to call to get an appointment? I've heard the comments that we will notify you, but I've never heard of the answer is how. Because this is the first I've heard of any of this information. It's certainly not on a public health website, so I appreciate your answer to that.
Yeah, I agree, Mr. Rector. We've been working really hard to get some of this information updated. It's been changing daily, even last night, working on it more today and over the next few days to get more clarity for you. It was a little bit muffled, so I apologize. Somebody stopped me. I believe your question was about address verification and whether they're residents of this county, but it muffled out a little bit for me.
No, my question is, what method are you going to use to communicate with us this information? Is it telephone? Is it email? Is it internet? What is it?
It cut out, so I apologize for not answering your question. Colleen, I see that you want to chime in here.
Hi, yeah, thank you, Sam. So public health will be utilizing all of the various communication strategies that we have. So we'll be utilizing our website, we'll be utilizing social media, but we'll also be utilizing some of the more traditional methods as well. We are going to be putting up flyers. We're going to be putting things in the newspaper. It will be in our press releases. So we'll be, once we get past the initial groups that we're trying to work with, we will be advertising it far and wide to ensure that everybody in Calaveras knows when their time to get vaccinated is here.
Can I suggest two other methods to get the communication out? PG&E does really well about talking about PSPS stuff, and they have the email addresses of everybody in the county. CCWD delivers water to everybody, every house. They have information as well, so you might want to think about using their services to help you with that communication.